My name is Nancy, the founder of Myafya Africa and a psychologist by profession. We have partnered with Ponea Health to bring to you a topic on drug overdose. Drug overdose. This is a biological response by the body when it receives one or many mix of substances that overwhelms the system. The overdose could be intentional or accidental. In instances where it is accidental, it depends whether this is a child who has been able to access medication where they are supposed to be out of their reach. In adults, there could be a prevalence of having a mental health illness that leads to this overdose. Overdose is a serious medical emergency that needs to be attended to. It can be fatal if it is not addressed in good time. Who are the people who are at risk of drug overdose? Young children, if the medications are left unchecked or they're put at a place where they can access them, it can lead to drug overdose as they play around. For adults, it's important to consider whether this was a prescription drug or illegal drugs that they are using. In the event it's a prescription drug, they probably might have used the wrong dosage prescription and thus end up with a drug overdose, or they got the wrong drug and by partaking it harms their body. In the cases of drug abuse, this is where individuals are taking drugs, and because over time the body requires more and more to be able to function at the same level, individuals can resort to drug overdose without them realizing, and this can result to them appearing at the A&E when they have already overdosed. The overdose in males is more common than it is in females. This is a result of the sociological and biological differences in the two. Women are seen to be more affected when they consume substances, and they're likely to end up in the A&E as opposed to men. But men are more at risk of abusing drugs and alcohol than it is to women due to accessibility. Also, our hormones also predispose with how the body reacts and responds to this drug consumption and overdose. How do we get to tell that someone is at risk of overdose? Individuals who are already using drugs, the body over time wants to have more and more of this drug dosage to be able to perform at the same level. So what happens is that as they continue consuming these drugs, the body gets to a point and gets overwhelmed and it's not able to function. At this rate, then the individual is going to be affected and will have to be taken for reversal at a rehabilitation center. Individuals may not realize that they are getting to overdosing levels, especially if they're impaired mentally. They need a lot of social support for them to be able to reverse this. What we need to realize is that drug overdose is a complex problem. An individual may not be able to deal with it on their own, and thus they'll require a lot of family support. And also, they also require that they may be able to identify where they can get this help, whether it's in a health system or they have someone who can refer them for this. And for this reason, it is important to note that overdose is reversible if it is addressed in good time, and individuals who are willing to work on it, they're likely to reverse this problem. And in the event that they feel like they're going to slide back to the same problem, they should identify a support system within which they are able to seek help from. Substance abuse in Kenya is actually increasing, and studies indicate that 10 to 19-year-olds are half of the users of drug users in Kenya. Some of the drugs that they abuse are nicotine, alcohol, and amphetamines. The reasons why people abuse these drugs depends also with their availability. What pushes people to take the drugs? Sometimes if people have major life changes, this may push them to abuse drugs without their knowledge, trying to seek comfort and console themselves. And continued use of them now could be detrimental to their body. That is why individuals need a lot of support system to deal with issues that are happening in their lives. How do you get to tell some of the telltale signs of someone who is abusing drugs? They're usually unkempt. They are unable to meet their obligations and responsibilities. If this is a child who is in school, they start performing poorly. You will notice that they also start stealing to be able to sustain this behavior. So money will start disappearing from home, and this can even cause family and marital strife. Also, individuals who experience abrupt major life changes, they can also start abusing drugs, trying to be able to comfort themselves. Now, an individual who has been confirmed and known to have an issue with drug use, they can be helped. It depends with how soon the family is able to get this person time. As you have said earlier, substance abuse disorder is a complex situation. An individual, by the time they're getting to dependence, their body has already changed. In fact, the center which regulates the self-control is already affected, so they are unable to get out of it by themselves. Here they will require a lot of support in facilities and also by their support systems, which includes the family and friends. And how can a person keep when they have started this process? How are they able to maintain clean after being able to find help for substance use disorders? What they can do is to ensure they follow up on their treatment keenly. If they're supposed to do support groups, they make sure that they follow up on them, because here they stay accountable to each other on how they are progressing with their recovery. We also need that they have strong support systems. They also need to have internal strength to be able to work on this. And anytime they feel like they are going back to the earlier behavior, should be able to talk to the people within their support group or their support system, that is the family and friends. We are glad that you're watching and you kept with us. We hope that you have learned. We hope to engage with you further by contacting Myafya Africa. We are on ponea.com and we hope to see you again. Thank you.